Hi, this is QD Clinic. QD Clinic is brought to you by RheumNow.live 2024. I'm Jack Cush with RheumNow. Today's case is about ANA positivity in an RA patient. Or is it? A 23-year-old gal, I've been treating her for about 4 years. She had been diagnosed as having monarticular JIA, I think at the age of like 16, 17. At that time, she was rheumatoid factor negative, ANA positive 1 to 1280, and had just one knee. She was treated for that one knee. I think she was given DMARDs and injections and whatnot. And then over time, she evolved into an oligoarthritis and then something that looked more like RA. Before I saw her, she had had a synovectomy of the knee. And the synovitis, and it was done because they were worried that it was, maybe this wasn't polyarticular JIA, which often has a positive ANA and a negative rheumatoid factor, but maybe this could be an infection. Nonetheless, the pathology looked like chronic inflammatory arthritis, much like RA, with a lot of polys, scattered neutrophils and plasma cells, no evidence of granulomas, and tests for fungal TB and other bacterial infections were in fact negative. When I saw her, she had about 4 or 5 joints. She was treated with, I think, adalimumab and methotrexate and leflunomide, and really didn't do well. And then because she was considering pregnancy, she was switched for not having a great response, and because pregnancy was being considered, she was switched to certolizumab and did better. And then more recently, now we're getting to today's visit, certolizumab was not working. And she was switched at a prior visit to tofacitinib and had done well for 6 months. But now she's back and about a month ago and was put back on methotrexate. And now I'm seeing her at their last visit. She's on methotrexate and Xeljanz and is doing very, very well. So, again, jumping around on therapies, what's interesting about her is that her response to therapies have been sort of short-lived. And her flares were backed up by swollen joints. So she's a bit of a conundrum. And is that because of what her real diagnosis is? Is she really RA? She does have bilateral symmetric polyarthritis of typically involved joints. She does have a biopsy that shows chronic rheumatoid-like inflammation. She is CCP positive at 125 units, I believe, and her ANA remains strongly positive. When she's inflamed, she has an elevated sed-rater CRP. And has no other extra-articular manifestation, has no Sjogren's syndrome, etc. Again, she's been ANA positive right from the start. So when I see patients that are both ANA and rheumatoid factor positive, and you're trying to figure out, is this lupus or is this RA? Look at the titer and, do that which is more thing. And that's probably how the story is going to go. Clearly, she has a higher titer of ANA than she does of CCP, and her rheumatoid factor is negative. But she's behaved more like RA. And the question is, what does the ANA mean in a case like this? Number one, you have to remember, of course, that using TNF inhibitor therapy can induce ANA positivity, and that would be TNF inhibitor-induced ANA without necessarily having drug-induced lupus, or it could be, in a very small subset of those people, evolve into drug-induced lupus, which could present with more arthritis, in fact. But this patient had ANAs positive at the very start before she ever saw or heard about a TNF inhibitor. When you see ANA positivity in an RA patient, you have to wonder about, are they going to be more difficult patients? There are some reports out there that say such patients may be more refractory and harder to treat. You have to worry about whether they may have Sjogren's syndrome that underlies or co-associates with this, because Sjogren's is associated more often with ANA positivity than I think RA is. 20% of RA patients are said to be ANA positive. And sometimes that ANA in an RA patient could be due to SSA or SSB antibodies as well. And other than that, I don't think it means much, and I certainly don't think it merits repeat testing. I have done it a few times because of the question of her not responding well, seeing what if she had changed serologically over time as far as rheumatoid factor or CCP or the ANA. In fact, she really never did. The good news is you just train the patient to be a good patient, which means call me when you're not doing well. Otherwise, keep your scheduled appointment and stay on these medicines. And if you look at how her CDAI scores have gone, and I'm just going to read them off to you. As you know, greater than 6 is active. Less than 6 is doing really well. Less than 3 is really good. This last visit she was 5. Before that, it was 11. 18, 9, 5, 5, 2, 8, 2, 3, 5, 10, 12. So not horribly bad polyarthritis, but enough that she was either in moderate disease activity or low activity, and then occasionally has stepped into better control. And I think that's where she is right now. So I'm happy with the therapy. But when you have a question like this, continually reevaluate. See the patient again. Reconsider the diagnosis, consider repeat testing if necessary, because, again, she's had plenty of opportunities. She's had arthritis since, this looks like it's going back, as I said, at least 8 years is what we'll say at this point, right? Patients may declare another diagnosis over time. I tend to think that patients who are going to declare a diagnosis after you've established a diagnosis and they're following them, that happens usually in the first 2 years. But anything's possible, especially when they're seronegative. This patient's not seronegative. Tune in for more QD Clinics.